What is the emotional experience like for someone with alexithymia? What does the emotional experience feel like for someone with alexithymia? This is a fascinating question that touches on how emotions are processed differently. Alexithymia refers to the difficulty in identifying, describing, and understanding one's own emotions. For someone with this condition, emotions can seem vague, confusing, or hard to articulate. This makes it tough to pinpoint exactly what they are feeling at any moment. When we consider alexithymia in the context of autism spectrum disorder, it's important to note that not every autistic person has alexithymia. However, it is more common among autistic individuals than in the general population. Research suggests that about half of autistic people experience alexithymia to some degree. This means that for many, their emotional experience is shaped not just by autism but also by the presence of alexithymia. People with alexithymia often struggle with using emotional language. They might recognize that an emotion is either positive or negative but find it challenging to explain why they feel that way. For instance, they may say they feel bad without being able to specify whether they are sad, anxious, or angry. This can lead to misunderstandings in social situations, making it hard for them to communicate their feelings effectively. Additionally, the experience of alexithymia can influence how someone relates to their own body. Some individuals may have reduced awareness of bodily sensations like hunger, pain, or fatigue. This disconnect can make it difficult to connect physical feelings with emotional states. For example, they might not realize they are stressed until they notice physical symptoms like a headache or tense muscles. Empathy, or the ability to understand and share the feelings of others, can also be impacted. While autism does not imply a lack of empathy, having alexithymia can make it harder to recognize and respond to the emotions of others. Understanding your own emotions is often the first step in understanding someone else's feelings. If someone struggles to know what they feel, it can be more challenging to imagine what someone else might be experiencing. Alexithymia is also linked to higher rates of anxiety, depression, and other mental health challenges, particularly in autistic individuals. This is partly because not being able to identify or express emotions can make it harder to seek help or use coping strategies. Traditional talk therapies may be less effective since they often rely on discussing feelings in detail. There are practical ways to support someone with alexithymia, especially in the context of autism. Teaching emotional vocabulary and using tools like emotion charts or apps can assist in identifying feelings. Mindfulness exercises and body scanning techniques can improve awareness of physical sensations that might be linked to emotions. Encouraging the use of alternative communication methods, such as writing or drawing, can also help express feelings without relying solely on words. It's essential to remember that alexithymia is not a choice or a lack of effort. It represents a real difference in how emotions are experienced and processed. For autistic individuals with alexithymia, the emotional world may feel less detailed or more confusing. However, this does not mean they do not feel deeply. With understanding and the right supports, it is possible to develop better emotional awareness and communication over time.